If you've been experiencing digestive issues and wondering what could be causing them, you are in the right place. In this video, we'll be taking an in-depth look at what IBS is and discussing its symptoms. So, let's dive in. Welcome back to our channel. Today, we're going to talk about a common but often misunderstood condition called Irritable Bowel Syndrome, or IBS. IBS is a chronic gastrointestinal disorder that affects the large intestine, also known as the colon. It is estimated that approximately 10 to 15% of the global population suffers from IBS, making it one of the most common digestive disorders. There are different types of IBS. The main types are IBS-D. This type of IBS is characterized by frequent diarrhea, loose stools, and urgency to have a bowel movement. People with IBS-D may also experience abdominal pain and cramping. IBS-C. This type of IBS is characterized by infrequent bowel movements and hard, dry stools. People with IBS-C may also experience bloating, gas, and abdominal discomfort. IBS-EM. This type of IBS is characterized by both diarrhea and constipation, with alternating periods of each. IBS-U. This type of IBS is used when the symptoms do not fit into any of the other categories, or when there is a mix of symptoms from different categories. It's important to note that IBS is a complex disorder, and symptoms can vary widely between individuals, even within the same type of IBS. It's also possible for a person to experience symptoms from more than one type of IBS. The exact cause of IBS is not fully understood, but it is believed to involve a combination of factors, including abnormal muscle contractions in the colon, heightened sensitivity to pain, and changes in the gut microbiota. Now, let's talk about the symptoms of IBS. The symptoms can vary from person to person, and they can range from mild to severe. Some of the most common symptoms include abdominal pain and discomfort. This is often described as cramping or aching pain in the lower abdomen that may be relieved by a bowel movement. Bloating and distension. Many people with IBS experience bloating and a feeling of fullness in the abdomen, even after small meals. Changes in bowel habits. This can include diarrhea, constipation, or a combination of both. The frequency and consistency of bowel movements may vary. Mucus in the stool. It is not uncommon for people with IBS to notice mucus in their stool. Urgency. Some people with IBS may have a sudden and urgent need to have a bowel movement. Other symptoms. Fatigue, nausea, and difficulty sleeping are some of the other symptoms that may be associated with IBS. It's important to note that IBS is a chronic condition, which means that it can last for a long time and may require ongoing management. It is a long-term health issue that cannot be cured completely, and the symptoms may come and go over time. But the condition itself does not go away. This can be challenging for people with IBS, as it can affect their daily life and overall well-being. Some people may find relief through dietary changes, such as avoiding trigger foods or increasing fiber intake. Others may benefit from medication. Since IBS is a chronic condition, it is essential to understand that managing its symptoms requires ongoing efforts. Treatment options for IBS vary depending on the severity of the symptoms, and there is no one-size-fits-all approach. If you're experiencing any of these symptoms, it's crucial to see a healthcare professional for an accurate diagnosis and appropriate treatment plan. Now, let's take a closer look at some of the potential triggers for IBS. While the exact cause of IBS is still uncertain, there are several factors that are believed to contribute to its development. These can include diet. Certain foods such as spicy or fatty foods, caffeine, alcohol, and carbonated beverages may trigger symptoms in some people with IBS. There are other foods include dairy products, wheat and FODMAPs, fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, which are poorly absorbed carbohydrates found in some fruits, vegetables, and grain. Stress and anxiety. High levels of stress and anxiety can have an impact on gut function and may trigger IBS symptoms. People with IBS often report that their symptoms are triggered or worsened by stress. Stress can have a significant impact on IBS, Irritable Bowel Syndrome, because the gut and the brain are closely connected, and emotional stress can trigger physical symptoms. Stress can affect the way the digestive system functions, leading to changes in bowel habits and symptoms of IBS, such as abdominal pain, bloating, and diarrhea or constipation. Research has shown that stress can exacerbate IBS symptoms by increasing the sensitivity of the nerves in the gut, causing them to overreact to normal stimuli. Hormonal changes. Some women may experience worsening of IBS symptoms during their menstrual cycles. Hormonal changes during the menstrual cycle can affect the function of the gastrointestinal tract. Gut microbiota. The balance of bacteria in the gut, known as the gut microbiota, may be altered in people with IBS, although more research is needed to fully understand this connection. Genetics. There may be a genetic component to IBS, as it tends to run in families. Research suggests that there may be genetic variations that increase the risk of developing IBS. Studies have identified several genetic variants that are associated with an increased risk of developing IBS, including genes involved in immune function, gut motility, and the processing of pain signals. If you suspect that you may have IBS, it's important to keep track of your symptoms and any potential triggers. Write down what you eat and drink each day, along with any symptoms you experience. You can also note your stress levels, exercise habits, and sleep patterns. This can help you identify patterns and make lifestyle changes that may help manage your symptoms. So how is IBS diagnosed? Well, there is no specific test for IBS. Diagnosis is usually based on a clinical evaluation by a healthcare professional, which may include a review of your medical history, a physical examination, and possibly some tests to rule out other conditions that could be causing similar symptoms. Now, let's talk about the treatment options for IBS. Although there is no cure for IBS, there are various strategies that can help manage the symptoms. These can include lifestyle changes. This can include dietary modifications, stress management techniques, regular exercise, and getting enough sleep. Medications. Depending on your symptoms, your healthcare professional may prescribe medications such as antispasmodics, laxatives, or antidiarrheal medications to help manage your symptoms. Psychological therapies. For some people, therapy such as cognitive, behavioral therapy, CBT, or gut-directed hypnotherapy may be helpful in managing stress and improving symptoms. Probiotics. Probiotics are beneficial bacteria that can help restore the balance of gut microbiota and may provide relief for some people with IBS. Probiotics are beneficial bacteria that can help improve gut health. They can be found in foods like yogurt, kefir, and sauerkraut, or taken in supplement form. Alternative therapies. Some people find relief from IBS symptoms through alternative therapies such as acupuncture or herbal supplements, although more research is needed to fully understand their effectiveness. It's important to work closely with your healthcare professional to develop an individualized treatment plan that addresses your specific symptoms and needs. Everyone's experience with IBS is different, and what works for one person may not work for another. In conclusion, Irritable Bowel Syndrome, or IBS, is a common digestive disorder that affects the large intestine. It can cause a range of symptoms, including abdominal pain, changes in bowel habits, and bloating. While there is no cure for IBS, there are various treatment options available that can help manage the symptoms and improve your quality of life. If you suspect that you may have IBS, it's important to consult with a healthcare professional for an accurate diagnosis and appropriate treatment plan. I hope this video has provided you with a better understanding of IBS and its symptoms. If you found this information helpful, be sure to give this video a thumbs up and subscribe to our channel for more informative content. Thank you for watching.